a collaboration with my friend Emily from Emily's Life on Wheels. I usually link her vlogs on the end of my YouTube description under vlogs I like. She's usually linked, but I'll make sure she's linked prominently in this video, and I'd urge you to take a look because she does a fantastic job of documenting her life, and I really look forward to watching her every day. We thought it would be interesting to do a collaboration about the treatments of cerebral palsy, which is a condition that we both have, and Emily and I are both have cerebral palsy, and we are both wheelchair users, and we thought it would be interesting to look at the treatments that we've had for the condition, whether it's particularly different in different countries, because Emily's from the USA and I am from the UK, and whether we would do things differently given the opportunity. I have CP, which is caused by a brain injury. In my case, it was a result of prematurity, and I was born 3 months prematurely, and I stopped breathing a lot and was ventilated and things. So, and I was in the neonatal intensive care unit for a good long time, but I survived, and I was diagnosed with cerebral palsy at the age of 2 years old. In addition to Emily and I being in different countries, I've got to also point out that there is a significant, I'm quite significantly older than Emily, so some of the things I experienced will be sort of reflected on the age of when the diagnosis was performed, if you see what I mean. Like when I was younger, particularly I had a very old paediatrician at first, and he didn't like to let parents know that there was a problem with their baby for as long, because he thought it would affect bonding. So my parents kind of trickled along for a while, and then my mum in particular, and she was a first-time mother as well, she kept saying to the doctor, I think there's something wrong with my daughter, she's not rolling over, sitting up, doing all the things you would expect for a baby to be doing. And at first she was sort of brushed off because I had been premature, so they say it takes premature babies longer to catch up, which it does, because people very often refer to their premature baby's age as so many months corrected, which takes account of the amount of months of prematurity, so that's how they can properly assess development. But by the time I was at about 1.5 years, it became very clear that this wasn't just prematurity, and the effects weren't going to go away by any kind of magic. So I was then referred to an orthopaedic surgeon who conferred with my paediatrician, and I was formally diagnosed with a form of cerebral palsy which is called spastic diplegia cerebral palsy, or sometimes, or more often in this country, it's called bilateral cerebral palsy. And and in the UK we very often use the gross motor function scale to sort of indicate severity of CP, and I am what's called a level 3 on the on that scale. So after I was diagnosed, I was put into an early intervention programme at my local special school. It was about half an hour away from where I lived, and I also had physical therapy at home for a short while before the major intervention programme began, because I'm an August birthday, and the school year in the UK starts in September, and the programme was all based around the school year. So when it came time for me to go, I went by bus in the morning and travelled half an hour to the school, and we did, in the very early years, we did lots of physical therapy. We did like movement, stretches. We had like a therapy room in the school, and there was also therapy-based equipment in the classrooms. So you would go for some stretching therapy like once or twice a week at school, and it was expected that your parents would carry it on at home. Mine did, some didn't so much, but mine were very attentive to carrying out stretches, which is apparently why I've grown so, or one of the doctor's theories as to why I managed to attain the height of 5'7". But I don't know whether he was being ironic about that or not. So we used to do like individual therapies a couple of times a week. Then we'd do like therapy in the classroom, like occupational therapy. They had boards, like sort of boards with zips and buttons on that you'd have in front of you, like a sort of almost like you would an iPad stand, but it would have different fastenings on, and you would have to learn how to do fastenings like buttons, or try to. I hated those things because I'm still useless at buttons even now. You'd have buttons, zips, Velcro, all the usual kinds of fastenings, and you had to try to do them as best you could yourself. They'd also concentrate on dressing and undressing, because independence was the sort of mantra, and you were viewed as more of a success if you could do things independently and do things by yourself, you know, like without any assistance, or with minimal use of aids. It was in this time that I first learnt to walk. I had a walking frame for a while, and then some 3-pronged tripod sticks. They were amazingly heavy, but and then I began to be able to do some stuff unaided. However, I used to walk like I was seriously inebriated, and I used to, in the corridors at school, I used to go from side to side and smash into each side and be bouncing around like the human pinball machine. That was one nickname I acquired for a while. The manual therapies continued even when we began doing academic type things. You would go out of lessons for individual therapies depending on what level of therapy you'd been assessed as needing. And within the classroom you would use things like standing frames. These are a frame, like a metal frame that somebody puts you into. Well, you usually put into it lying down, and then you get raised up into a standing position, and it maintains your posture as well. It maintains a good standing posture and gives you an amazingly, well, it gives you a very functional stretch. I would love a standing frame as an adult now, but standing frames aren't actually funded for adults in the UK under any circumstances I've yet found. And I don't actually know whether I'd be able to do it anymore with my hips being very dislocated at the moment. So that's another thing. So and there was a pool as well at the school, and it was like a hydrotherapy pool, so we did water therapy. We did hydrotherapy programs individually, and then we'd have a class swim once or twice a week as well. So when you went in the water with a therapist, they'd work on core strength and movement and that kind of thing, and walking and control in walking. That was also a big thing. And then you'd have just what they called a class swim, where all your class group went in, and we did just what you would call a normal swimming lesson. It was adapted in some way, of course, because we all had some level of impairment or function, but most of us learned to swim fairly well in the end, in our way. I don't swim with my legs well. I can if I really think about it, but I tend to sink. I'm more of a successful and strong swimmer with my arms, and it was encouraged to make the most of your strength. So and it was definitely really good therapy. And we also, in some parts of the year, we sometimes had a group of sessions with what's called the Riding for the Disabled Association, and they did therapy with specially trained horses, and that was my favourite therapy, because I went on to love horse riding and do it outside of the therapeutic environment. But that was brilliant, and it really helps strengthen core muscles. It gives muscles a really good stretch, and I think it was one of the best interventions I had in my early years, purely because it was therapy and intervention without feeling like therapy and intervention, and it was something I could do outside with friends. And once I was actually on the horse, I could do lots of things in the same way that they could, better than if I was on my two legs, so I enjoyed that very much indeed. The same with the swimming. As long as the water was warm. If the water was cold, I became completely useless. So I was very lucky in my younger years that I didn't need muscle release. Lots of people with cerebral palsy require a muscle release or muscle releases at some points, and lots of my friends have had them done. But the therapist I had at home had always advised my parents against me having any kind of muscle release. And this is perhaps one of my biggest regrets, because now I am suffering. I have massively increased tone as an adult, more than I ever did as a child, partly because you can't access therapies funded therapies very easily in the UK. So my tone has become very much more increased than it was because of the lack of intervention, because obviously my dad is older now than he was, and he can't give me the level of stretching and intervention I had when I was younger, and I am bigger and harder to manage for him. So that's a big problem. And also you can't get maybe the equipment and sort of hands-on help that would make life a lot easier. So I did fairly okay in terms of sort of treatment until puberty hit, or until I had a sort of my last growth spurt, which was probably between sort of 10 and 12, and I began to have quite serious pains in my joints, my knees, and I was becoming much more stiff, and my knee or my knees were starting to rotate inwards, along with my feet. I was at that point walking on the insides of my feet and not necessarily the soles. So I'd had like plastic braces in the past, but then they'd said to only wear them at night after a while because they thought that would be a better intervention. Now, I think in retrospect I would have done better had I have kept the AFOs on in the day. I think nighttime AFOs are just cruel, to be quite honest, because you don't get proper sleep. If I'm going to be uncomfortable, I'd rather be uncomfortable in the day. I don't like being uncomfortable at night, so anybody who makes anybody wear nighttime AFOs is just utterly unpleasant, in my opinion anyway. So things were sort of going downhill with my joints, and I was finding it. I'd also lost a lot of stamina as well for doing things, and I was having to use my wheelchair more and more. And I used to see an orthopaedic surgeon about twice a year just to check on me, and he'd been hitherto very reluctant to do much on the operation side of things, until my joints started being, because the increased tone, Emily explains this very well. I have significantly increased tone in my lower body, and to some extent in my upper body as well. And some muscles are more affected by this tone than other muscles, so it can sort of pull parts of you, like it can pull parts of your leg into a sort of unnatural position, and it makes walking much more difficult than it would be, or would or had been for me in my case. So then it was decided that that I would have what's called a derotational osteotomy, and this is essentially I had my leg broken in about 4 or 5 places, and because my hip is sort of out of socket, the surgeon rotated both the top and bottom of my leg and fixed it back into position with metal plates and screws. This had a very long recovery process, and it was about 12 to 18 months of recovery, and that was with massive, I had a massive increase in therapies at that time, and the leg was actually straighter and it looked cosmetically better, but we never got it to function quite as well as it had before. But then the same began to happen with the right leg, and so I had the bottom of that leg rotated back into position, and then in a separate operation later I had a piece of bone put into my ankle to try and stop me walking. Instead of walking on that part of my foot, he aimed to try and make me walk like more back on the flat part of my foot, and then it sort of helps save your bones in the long term, or that was his idea. So, and the bone graft in the bottom of the ankle was actually, it was one of them, it was probably the second most painful operation I've ever had. So, and that cosmetically went all right as well, but I mean, I used to occasionally get like a burning sensation in the ankle, a bit like as if it touched a nerve. And then ever after, I walked on crutches, walked on crutches in the house, and I could do very small distances outside. But by the time I was 21, I'd lost the ability. I walked until then, and then I became ill because I had an infection in where the plates in my legs used to be, and I developed osteomyelitis, which is an infection in the bones, and this was a long-term thing to get rid of, and I still have flare-ups of infections now. So it was after one of these flare-ups that I sort of became quite ill, and sort of collapsed outside my doctor's surgery in a severe amount of pain, and when I went to the hospital and met with my regular neuro rehab doctor, he sort of thought it might be time to start looking at using a wheelchair full time, because although CP is not a progressive condition, sometimes as we age, we can sort of age quicker in some ways, so we kind of wear out faster, we need more energy, and it's harder for our bodies to keep up with demand. So I have been a permanent wheelchair user ever since I was 21, and then at the age of 25 I had what's called an intrathecal baclofen pump implanted. It's a pump in your stomach, it's implanted into your stomach, and it delivers medication directly into the spine, because the tablets, having the same medication in tablet form, can make you more than a little drowsy. I had tried it briefly when I was at like the end of school and the beginning of university, and I was falling asleep all over the place, so I thought it was time to try something different, because because of my increased tone was making things difficult for me. It was difficult to get dressed and things, so I went ahead at the time and had a baclofen pump implanted, and the first pump I had produced amazing results. I was able to get more movement, and the tone in my legs was much decreased, and I had much less pain and so forth. However, a couple of years after the first pump, the catheter in the pump detached, and obviously my tone came back, and then I had the pump replaced again, and we've never been able to get or maintain the original sort of results. I still have a baclofen. I'm on the third pump now, and we've never been able to replicate the first results, or the first baclofen pump implantation results since, which is a bit sad, but I'm not the only one who's had this experience, and I'm now on quite a high dose of the intrathecal drug, and I also take oral antispasmodics as well to help with my upper body function, which has been that was very difficult at the beginning, because it sort of slows your thinking process a bit, and you get more sleepy and things. And I didn't want, for many years I didn't think of myself as an ill person, and for me tablets were for ill people. If I have perhaps one regret, it's not, or I wish I'd have taken oral antispasmodics when I was more well, to perhaps negate the sort of problems that I would have in the future. Also, I have had some neurogenic bladder issues. My bladder does not empty properly, and I don't get the sensation of it being full necessarily. So I have what's called a suprapubic catheter, and I've had that for it's coming up for about 20-ish years now. So, and that's one of my, if I'm thankful for two surgeries, it's that, and the colostomy I had, because when I was younger, I've had intestinal motility difficulties for most of my life as well, and these got worse and worse as I aged also. And then I had what's called a volvulus, which is when part of your intestine sort of tries to twist because it's not processing things at the speed it should do, and it's got too much bulk in it. So I had a colostomy about 3 years ago, and I've been in a much better condition since I've been able to eat food properly and enjoy things. I've had much less intestinal pain, and those are the things that is so valuable. And I wish I'd have gone in for the catheter and the colostomy much sooner than I did. I wish I'd have pursued it rather than allow myself to be put off and think it was like a failure, because it definitely wasn't, and it's allowed me to do more things. Similarly, I think I would have liked to have, or I think it would have been better if I had used my wheelchair more when I was younger, and it would have prevented a lot of falls and damage and things, and like saved my body for later years. Whereas I don't think at the time when you're younger people think about what will happen when you come to sort of in your 20s, 30s and older. I don't think people ever conceptualise these young children that they're providing therapy and assistance to as at one point being adults and middle-aged people. But and I would also like to see better care offered for adults with CP as well everywhere in the world, because I don't think we are as well, because it's seen as a non-progressive, and it is non-progressive in that the damage itself in your brain does not further deteriorate, but its effects can deteriorate. So I would like to see specialised adult CP research and adult CP physicians in every country across the world where possible, and make sure that people routinely have access to proper support and new treatments and possibly new medications and that kind of thing. I hope you enjoyed this video. I will see you soon, and pop along and look at Emily's videos as well, and I will see you in my next video. Bye.